I'm going to give you 5 criteria. Okay? If you have any of the 3, you have metabolic syndrome. You have syndrome X. Criteria number 1, your abdominal, okay, obesity. Many people will fail. First one only fail. Oh yeah, that's it. Okay? Very easy. Men, anybody greater than 40, female, anyone greater than 35, you fail in the first one. Check. Will you have this? If you fail here, fail 1, 4 to go. 1 down, 4 to go. You need to fail 3, that's it, you're out of the metabolic syndrome. Check. Are you there? You will know. This is all personal things you must know. Okay? Normally we do metabolic syndrome, we look for people who are a bit fat. We know already one criteria they fail. So we catch them. Number 1, abdominal obesity. I told you what? Waistline is your lifeline. Number 1. Number 2, your cholesterol. Our 3 highs today. Cholesterol. Now, go back to your last medical report. Check your good cholesterol. If your good cholesterol is below 1 for men and below 1.3 for ladies, or if it's very hard to remember, go and check your total cholesterol. What is the magic number? You should be below 5.2. If you are anything above that, you fail the second criteria. Let me tell you the truth. Many Malaysians have got high cholesterol. Very famous, very easy to catch. Cholesterol is so common nowadays. Okay? Number 3, what is triglycerides, Dr. Haresh? Lemak, fats. If your fat is above 1.7, you fail another criteria. If you have a lot of fats, you got a lot of cholesterol, you are asking for trouble. Heart attack is on the way. Okay? So we talked about 3 criteria. Number 1, waist. Number 2, HDL, good cholesterol. Number 4, triglycerides. Some people ask me the question, how do I increase my good cholesterol? I tell you, but you won't like it, the method. Can I eat a pill? I can increase my good cholesterol. There is no magic pill. How can I saw the pill, I can eat the pill. No pill. There's one pill, there's a very bitter pill. What is that? Exercise. When you exercise, your good cholesterol will go up. People are, yeah, they want very hard, I got no time, Dr. Haresh, but exercise cannot. I got no time. I can exercise my finger, WhatsApp, they want all very clever. Ayo, I tell you, the whole day on WhatsApp, finger can exercise, but no time for exercising the body. Number 3, your blood pressure. The moment your blood pressure is above 130 or above 85, you fail another criteria. Okay? Blood pressure. Nowadays people with 30 something years old taking blood pressure medication. Once you take medication, that means we fail. That's it. And the last one, your sugar. If your sugar is above 6, I'm sorry, you fail another criteria. Do you have 3 out of 5? If you have 3 out of 5, you are on the way. You definitely have metabolic syndrome. Please make a U-turn as soon as possible. You may be leading to heart attack, diabetes, stroke. Okay? Metabolic syndrome. What happens? Okay? Now, when we eat rice, bread and everything, what is the final outcome? What do I get? Glucose. Glucose will be brought into the cells. Who can go into the cell? Only one person can tell the glucose to go in the cell. Insulin. Insulin has the key to allow the glucose to go in the cell. But if you don't have insulin, your glucose will remain in the blood. If glucose remains in the blood, your sugar level becomes higher. Sugar level becomes higher, you end up having diabetes and all the complications. There? Okay? Metabolic syndrome. When there's high glucose in a healthy person's body, the insulin will knock the door. Top, top, top. The cell will say, what do you want? The insulin says, take the glucose inside. The cell will say, okay, I go inside. No problem. This is a healthy person's body. Okay? But then, once the person becomes more and more ill, what happens? Insulin knocks the door of the cell. Hello, open. The cells don't want to open the door. Hey, insulin says, open. I'm insulin. I open the door. The glucose will go inside. The cell says, no, we don't want to open the door. Insulin is in trouble. Insulin is there, but the glucose cannot go in. What happens? The glucose in the blood becomes what? Higher and higher. So, insulin gets angry. More and more insulin released by the pancreas. More and more insulin come and knock the door. Still the cells don't open. Now your body is in a big problem. Insulin also very high, glucose is also very high. You are in a deep problem. That's where they call it insulin resistance. Your body is having a great problem. Cells become very resistant. Then the top picture is the normal body. Wow, so nice the glucose go in the cell. See the man flowing? The second picture cannot go in the cell. Now why? There's another person blocking. That is what happens in insulin resistance. The glucose cannot go into the cell. Okay, poor thing, some people, their body is shouting for sugar, but the sugar cannot reach the cell. Typical of diabetes people. They crave. When you crave for sweet things, that means your body is not doing well. Okay? Your body is lack of magnesium definitely, which is very rich in green products like Barleygreen. A lot of magnesium. Okay? As you can see that. Metabolic syndrome, what are the effects? Number 1, free radicals. Oh my god, scary. Number 2, inflammation. Number 3, lipid profile haywire. Number 4, hypertension and heart problems. Number 5, fatigue, low magnesium. Number 6, decreased sexual function. Oh, that's another problem. Just gave an article 2 days ago. The men in Teluk Intan, a lot of men having erectile dysfunction. They found out how come a lot of men in Teluk Intan, how come? Then they found out that majority of these men with erectile dysfunction, poor thing, they were all 90% diabetes patients. When you have diabetes, your risk for erectile dysfunction becomes higher. And then these poor people, they don't know actually what must do. You must control your sugar. Once your sugar is under control, automatically the erection problem will slowly go away. But they go and take Viagra and Bagra and Chakra and all these stupid things they go and buy from the roadside where they will get Viagra and Bagra and all. And while taking Viagra, they get a heart attack and they die. Are you worse? That's what happens. Because when you take Viagra, your heartbeat will become very fast. And many men who take Viagra, they are above 50, above 60, the heart cannot take it. So they get heart attack. That is the problem. So when you solve one problem, you get another problem. This is what happens. Okay? Osteoporosis, hypothyroid, this is the daisy of metabolic syndrome. You can see. Okay? All of this actually basically what confer metabolic syndrome. Our 3 highs, glucose, cholesterol, and also blood pressure. Okay? As you can see there. Who is at risk? Anybody above 40. Must check for metabolic syndrome. Nowadays, forget about above 40. School children are having metabolic syndrome. This is the latest finding. In US, school children have metabolic syndrome. How can, Dr. how can school children get metabolic syndrome? Can. You know why? They look like burger, they eat burger. Look at the one, you look at his hand like that nice burger, like his face so cute like burger. So nice you press the cheeks and say, oh my god, this is what we want. This one grow up, the shoe become unhealthy. There's so much of obesity. Eat burger, become burger. Eat potato, become potato. This is what we have for you. Very, very clear. Okay? True or not, this is what we have today's lifestyle. Okay? Who is at risk? People who are very big. Check your BMI. If your BMI is above 25, you are in trouble. BMI should be 25 and below. Check your BMI. Very important. And anybody with family history of type 2 diabetes or diabetes during pregnancy. That's dangerous. If you get diabetes during pregnancy, that means in 5 or 10 years' time, you are going to develop diabetes. Most women who had diabetes during pregnancy, all of them finally became diabetics. Definitely. It's just a matter of time. Okay? Prevention. You're all not nice. Dr. Haresh, you say all not nice things. Exercise, doesn't sound nice. Lose weight, oh, difficult. Stop smoking, oh my god. Nowadays people smoke on you or smoke on your face. So, okay? Eat sensibly, take dietary supplements, regular medical checkup. Okay? People say, I cannot lose weight, I go for shortcut. What is that? Liposuction. Easy only, man. So easy. There was a late singer who passed away, Sharifa. She used to go for liposuction. Okay, I remember, I remember reading about it. Poor thing, she passed away very young age. 60 something when she passed away very young. I think she had a heart attack or Sharifa, very good singer. Okay? That's what happens, okay? Exercise, how much do I have to exercise? 30 minutes only a day. How many times a week? 3 times to 5 times. That's all you have to do. Very easy. 30 minutes only. 3 to 5 times a week. That's all you have to do. Okay? 30 minutes a week. Then you ask me, those days my grandmother never exercise, never go for walk. How come they're so healthy? Because they do housework. True or not? Those days they do housework, so no need to exercise already. Why? They mop, then they want to make anything, they grind the chili, they tumbo like that. Nowadays ask the tumbo, the girl will tumbo. True or not? You ask the girl to try tumbo, they blend the tumbo. Nobody will do anything. You buy a blender for carrying, no need to eat this. True or not? No more, cannot right now. We have gone regular exercise. So much of benefits. You have, actually the day you don't sweat, better get worried, you know. The day you sleep at night, you direct sweat today or not? If you did not sweat the whole day, you better be worried, something is wrong with you. You must sweat every day. Berpeluh. If you don't berpeluh, you are very dangerous, man. Your toxins will come out of your body. What kind of thing is the whole day the aircon only? Some people, I cannot sweat at all. How like that? Like Putri, what? Lead like that? I cannot anything. I must be in the aircon, car aircon, office aircon, toilet also on aircon, mental everything aircon. Oh, yo, I tell you. Cannot, the day you don't sweat, you'll be very worried. Those days people, they sweat so much, to do a lot of work. Now more. That's why the diseases are becoming more. That's the problem. Lose weight. Okay? Start losing your tummy. We do not want men in Malaysia with the pangkat PJK from Sultan. We do not want. What is PJK? Not a nice pangkat. Perut jalan ke depan. We do not want that. Okay? That is a not nice pangkat. We do not want that. Many men, you see, push the trolley, the perut jalan ke depan. We do not want that. Okay? Please, we do not want that. Once you lose weight, wow, insulin go down. Yes, blood pressure go down. Food. And diabetes also goes down. Everything goes down. Perfect. Stay slim and trim. Very important. That's what you have to work for it. You have to work for it. Very important. Okay? Stop smoking. Very important. If you know anybody who's smoking, every cigarette starts to about 30 million free radicals. Definitely. You are killing yourself slowly. Some people very smart. They don't want to kill themselves alone. They kill other people together. They smoke with people. So I die, all die. Very clever. Okay? They want to kill everybody along. Okay? This is what you should be eating. Very important. I just spoke today morning for brain health, for natural, for the 3 highs that we have. Are you eating 5 colors every day? Okay, discount like times are bad. 3 colors every day. Your plate, 1/3 of your plate that you eat must be fruits and vegetables. Is it 1/3? I don't think so. 10% also don't have. So you're not doing it. Dr. Haresh, what are the 5 colors? I said purple. Where got purple color fruits and vegetables? God, brinjal is purple. Purple cabbage is purple. Red color, number 2, chilies, capsicum. That's not tomatoes. What? All the colors got. White, Dr. Haresh, please stop it. There's no white color. God. Reddish, garlic, sengkuang, all of them are white color. Next one, orange and yellow. God. Carrots. Finally, the best, green. Oh, green got lot. Are you eating the green? Barleygreen. There are a lot of greens we have. Are you eating the thing around? Ask yourself. I always tell people, no important you have the knowledge, but you must apply the knowledge. Then it's important. Eat it. Cut down the 3 poisons. What are the 3 white color poisons? White color poison. Number 1, sugar. Number 2, salt. Number 3, plain flour, which is hopeless, nothing inside. Tepung gandum. That is the worst. Eat good flour, wholemeal flour. Atta flour, this is the good flour. Corn flour, still not so bad. Tepung gandum, plain flour, but nothing inside. All refined already. They have taken out all the taken out all the fiber, nothing left to give you. Then roti canai, all plain flour. That's why it's not very good. You see, plain flour, the price is cheaper than atta fiber. Check, you see, much cheaper. It's not good. Reduced. Pizza, what flour is that? Plain flour. Oh, you think what you're eating. Okay, check what you're eating. Okay, USDA food pyramid. This food pyramid is very old-fashioned. We want a new one. First start with exercise at the bottom. That is a good pyramid. Okay, always use the last of the top and the least. Okay, white bread, white rice, all make sure you eat very little. Not very good. Okay, as you can see that. Wow, I didn't know, man. Even come out in the New Scientist magazine, stop, don't eat anymore until you have read about syndrome X. Oh, come on. It became so popular once upon a time until they talk about syndrome X. It's so popular.